Why does my bladder infection cause lower back pain? Imagine feeling a burning sensation when you urinate, needing to go frequently, and then suddenly experiencing a dull ache in your lower back. You might wonder how these symptoms connect. When you have a bladder infection or cystitis, bacteria invade the bladder lining, causing inflammation and discomfort. Usually this causes pain or burning during urination and a strong urge to go often. But sometimes, people notice lower back pain too. This is often a sign that the infection has spread beyond the bladder to the kidneys. The urinary tract includes the bladder, urethra, and kidneys. If bacteria travel up from the bladder through the tubes called ureters, they can infect the kidneys, leading to a condition called pyelonephritis or kidney infection. When the kidneys become inflamed, it can cause pain in the lower back or on either side of the back, just below the ribs. This pain can be constant or worsen over time if the infection is not treated. In addition to back pain, kidney infections often come with other symptoms like fever, chills, nausea, vomiting, and sometimes blood in the urine. These signs indicate that the infection has moved to the kidneys and needs prompt medical attention. Usually, antibiotics are prescribed to treat the infection, and most people start to feel better within a day or two. However, full recovery may take up to 2 weeks, especially if the infection was severe. It's important to understand that lower back pain during a bladder infection is not just a random symptom. It signals that the infection may have reached the kidneys, which is more serious. If left untreated, kidney infections can lead to complications, so seeing a healthcare professional quickly is essential. Treatment typically involves antibiotics, and in severe cases, hospitalization might be necessary to manage the infection safely. From a bladder health perspective, it's also good to know that bladder infections and bladder cancer are different conditions. Bladder cancer usually presents with blood in the urine, changes in urination habits, or pain if it has spread, but lower back pain is less common unless the cancer has advanced. Persistent urinary symptoms should always be checked by a healthcare provider to find out the cause and get appropriate treatment. In summary, if you have a bladder infection and experience lower back pain, it often means the infection has spread to your kidneys. This situation needs medical care to prevent further complications. Always seek advice from a healthcare professional if you notice these symptoms, so you can get the right diagnosis and treatment. Remember, early intervention helps protect your overall health and bladder function.